Welcome back to 30 at 6 on Cecil TV. In May, County Executive Alan McCarthy appointed Lauren Levy as Cecil County's new health officer. Lori Humphreys had led the department since the former health officer Stephanie Garrity's departure in August 2018. But now the position has a permanent occupant. Welcome to 30 at 6 and the long overdue congratulations.
Thank you very much.
First, tell us a bit about your background.
Absolutely. So I have been working on issues related to health in some way, shape, or form for more than 20 years, largely in academic settings focused on public health research and programs. Mm-hmm. I've worked on a variety of topics, including childhood obesity prevention, gambling disorder, antibiotic-resistant infections.
Wow,
really
all over.
Yeah, all over the place, a really wide range. So my professional background is quite varied. I've also had the opportunity to do work in other settings outside of academia, including working with the Maryland Office of the Attorney General and the Medicaid Division, working on some of that regulatory work, as well as with the Department of Juvenile Services, Baltimore City Circuit Court. I did some short-term clerkships there in juvenile court, working on juvenile delinquency cases and child in need of assistance cases. And those experiences were really valuable to give me a different perspective on how our health system and broader systems work or don't work effectively. In addition, my most recent position was at the University of Maryland Carey School of Law, where I was the managing director of the Law and Healthcare program, which is one of the law school specialty programs. I have training in both public health and the law, and I am particularly interested in the intersection of public health and public policy.
That is very cool. And what drew you to the health officer position in Cecil County?
So one of the things that I felt I was missing professionally was a connection to the real world. Academia can feel somewhat removed, and I was really looking for a role where I felt like I could have some sort of direct impact. And so this opportunity came up, and I'm just delighted that it worked out, and I'm really very excited. It's kind of a public health nerd's dream come true. So.
Well, we're very happy to have you. We sat down with your predecessor, Stephanie Garrity, about 2 years ago, and we talked to her about what the department's top 3 priorities were at that time, and they were access to substance use and mental health services, chronic diseases, and social determinants of health like homelessness and poverty. Have these priorities shifted over the last few years or largely remain the same?
So this is a very timely question because we just completed the Community Health Needs Assessment process that was led by our Community Health Advisory Committee, which is chaired by Dan Coulter, who is the Director of Health Planning at the Health Department, and Jean Marie Kelly, who is the Community Health Benefit Coordinator at Union Hospital.
And that group is various stakeholders and heads of agencies who are involved in promoting health in the county. Is that correct?
That's correct. And we also welcome participation from the public.
Right.
So this is really an opportunity for members of the community at large to be involved in this priority setting process. So they just completed the Community Health Needs Assessment for fiscal year 2019, and as a result of a variety of focus groups and a community-wide survey that was conducted, they've identified 3 priorities for the next 3 years. And those are, again, behavioral health, which includes both substance use disorder and mental health conditions. The second is cancer, with a particular focus on lung cancer. Lung cancer is the greatest cause of cancer mortality in Cecil County. And we have much higher rates of tobacco use in the county than in other parts of the state. And then the third area is childhood trauma. So exposure to adverse childhood experiences has long-term impacts on health outcomes. So that's another area we'll be focusing on.
And I would think that the county's troubles with substance use are very much linked to childhood trauma.
That's exactly right. These are multi-generational issues. We have children who are exposed as newborns. We have children who are exposed to their parents who are struggling with substance use disorder. parents who are having overdose in front of them. So that's obviously a very traumatic experience. And so there are some efforts already underway to help address those and, work with those children to get them the resources that they'll need.
Mm-hmm. What are some of those efforts?
One of them is the name is going to escape me, Handle with Care program, and that's done with law enforcement agencies and the Department of Emergency Services, so in conjunction with the Cecil County Public School System.
Oh.
So if they identify a child who has had one of these experiences where they are in a setting where they're dealing, they have a parent who has substance use disorder, who has experienced an overdose, they can contact the public school system and let them know. They can't, because of confidentiality issues, really get into any details, but they can alert the school that this child needs to be handled with care so that the school can be on alert for any behaviors that might be out of the ordinary and really provide some extra support to that.
It seems like Cecil County has a lot of great programs that involve partnerships between the health department, the public schools, and law enforcement, and that's another example of them.
Absolutely. That's one of the things I've been so impressed with in my just 2 months here is the level of collaboration among the agencies and the level of commitment to work together among the various stakeholders. And I think it's one of the reasons you're seeing, I think it's a great way to effectively marshal limited resources, but also everyone is committed to the same goal and, trying to address that together instead of, small efforts. It's really a combined effort. So that's been really wonderful to see.
Right. What is the status of the county's harm reduction program? I knew that the target start date was April 1st, but I haven't heard much about it lately, and I know that there had been some level of controversy.
That's correct. So the harm reduction program, we call it Harmony, launched April 1st. We are doing that in collaboration with Voices of Hope, which is a community-based recovery organization here in the county. So that is being led by Katie Carroll of the Health Department and Erin Woody from Voices of Hope, and they've really been doing an outstanding job. Part of the controversy has been the syringe services aspect of the program. The thing that we are really focused on is that these programs, syringe services programs, there's strong evidence that these programs reduce transmission of HIV and hepatitis C. In addition to helping link people who would otherwise not be connected to resources and care, it's really about bringing people out of the shadows and building those relationships so that when they're ready to seek treatment, that we already have that relationship with them and, hopefully encouraging people to seek treatment. In the meantime, reducing the risk of disease transmission, which affects not only those individuals, but, their family members and medical personnel and law enforcement. So it is really about reducing harm, to the wider community.
As you know, the Washington Post recently made available state and county level data from the Drug Enforcement Agency on opioid pill shipments to pharmacies over the course of 2006 to 2012. And the data shows, just in one example, that the former city pharmacy in Elkton dispensed nearly a quarter of about 36 million opioid pills dispensed in the county overall, making it the third largest dispenser of opioid pills in the entire state. What can Cecil County Health Department do about pharmacies that are perceived to be pill mills?
So I think you pointed out that these data are from 2006 to 2012. So the prescription drug monitoring program that has been implemented by the state, that was meaningfully launched in 2013. And so what I think you've seen is actually a huge reduction in the number of prescriptions written, and certainly overdoses related to prescription opioids. I think the epidemic has changed. I think that the prescription drug monitoring program has been quite successful because you have seen those reductions in the overdose deaths. So I think that that problem is being addressed. And I think it also speaks to the need to have near real-time data to be able to understand what's happening at the current moment, to be able to effectively address what's going on. What's happening now is we're seeing huge spikes in overdoses involving fentanyl.
Right.
And so how do we address that issue?
Right.
You know, I think not that we don't have to still be vigilant about prescription opioids, we do, but I think that the prescription drug monitoring programs have been largely successful.
Right, and the problem has evolved.
Right,
too.
exactly.
Right.
And so our response needs to evolve.
Okay. Well, it has been wonderful meeting you, and thank you so much for being here.
Oh, thank you.
Lauren Levy is the new-ish Cecil County Health Officer. Thanks again.
Thank you.